Jenny, it's so nice to see you. How are you?
I'm very well, thank you, Sophie, and thanks for giving me the opportunity to take part in this.
Well, thank you for agreeing to share your story. You know, it's so important to capture the lived experience. So I'm really, really grateful to you for giving up your time. I think it's probably worth starting just with an introduction. You know, tell me a little bit about yourself. Um, um, Go ahead.
My name's Jennifer Charles, and I live in Penarth, and I work as a software developer for a Cardiff-based technology company. I live alone with my cats, and I teach yoga in my spare time. And I have two children aged 18 and 11 from different co-parents, and I see them regularly, which is great. So I've got a pretty good life, I would say. Um, I began my transition in 2012 in earnest, and I had surgery in 2019.
Great. Okay, thank you so much. And in terms of the surgery, tell me what sort of surgery, what sort of genital surgery did you have? When did you have it, and where did you go for it?
I had the penile inversion procedure,
Hmm.
where the clitoris and the vagina is made in the same operation. That was with James Bellringer, and it was at Parkside Hospital, which was contracted by NHS Wales.
Okay, so you had vaginoplasty surgery with James Bowringer in London, and at the very start of 2019. So it's been a good 18 months since you had that done. I just want to go back to the time before surgery in terms of the preparation that you had to make for that surgery. Um, Obviously, at the moment, you probably had to have a hormone blocking injection to reduce the amount of testosterone in your system. Did you have to take that?
Yes, I did. So at the same time, when I started the estrogen treatment, and I'm still on the estrogen now, I had to take regular 3 monthly jabs of Decapeptyl. And so the jabs I had for probably 3 years or so, 3 or 4 years leading up to the surgery. I found that I was fine, apart from maybe feeling a bit sluggish and low on energy for the 2 days after the jab. But I didn't have a problem with the injection itself. So every 3 months you'd go into the surgery and have a jab and carry on with the day.
Great.
And it successfully kept the testosterone down to below 1. And prior to that, my readings were 30, 31.
Yeah, so obviously the jab is something that brings down the testosterone down into sort of a very low range. And the idea behind it is that in the run up to genital surgery, where the testes are going to be removed, the idea is that people experience what that might feel like, having the testes removed, and this injection achieves that without surgery, so that we can identify anyone who might be struggling with particularly low energy, particularly low sexual drive, sexual function, people who may well have a problem after surgery, to sort of think about what things
Yeah.
might be able to put in place. But it sounds like you tolerated it really, really well. So let's kind of approach surgery then.
Yeah.
And you would have had your first outpatient appointment with Mr. Bellringer. Do you
Yeah.
describe that for me? How was that?
Yeah, I do remember it. It is a problem of, transport generally, with trans people getting time off work, or not having the money to fund it. So yeah, it's problematic. So it's like a pilgrimage, whenever you go to London, because you've had to sort of, save up for it, and, make the time for it and everything. And it's a big deal, going to your first outpatient. And because I'd been through, had been in the system for so long, and right from the beginning I was having to kind of like, lobby and campaign my way through it to get past the barriers that I encountered. I was approached it like that, thinking, right, I've got somebody else who's gatekeeper, who I've got to persuade to open the gate for me, but it wasn't like that at all. I was, surprised at how the effort that the nurses really made an effort to make you feel comfortable and welcome. And before I saw Mr. Bellringer himself, I had a chat with the nurse, and took me through basic outline, and that was really helpful. And so the actual appointments with Mr. Bellringer himself was fine. I was surprised at how straightforward it was, and I wasn't there to plead to have something done in a certain way. He was just saying, right, I'm going to do this, and then I'm going to do that, and then it's going to be done like this. I thought, really? I need to jump through some hoops now, or do a little dance or something, so it was very straightforward, actually. And then your details were on the system, and so everything was explained to you about how things were going to progress from then, with down to when to expect the letter with the actual dates, and what you need to do leading up to it. And the nurse was very clear about, once you're in the system, they've got like an open door policy for queries. So if you need to ask something, you had an email address, so you could email them. So if you'd forgotten about something in the appointment, it wasn't the end of the world. You could ask a question later by email, which is really helpful. And that will, put your mind at rest as well, because everybody worries, right, I've got this one appointment, am I going to remember everything, so yeah, it was fine. First outpatients was fine.
Great. Well, it sounds like you had a really good trip, and everything was well organised and made you feel confident in them, which is so important, isn't it? It's such
absolutely
such a big deal. And I do that idea of going with your armour on does resonate. Unfortunately, I hear that a fair bit, but it's so nice that you left feeling that wasn't required. You could take it off, and you could have a conversation, and it was very pragmatic about what would happen, and you felt that when you left, that this was actually going to happen. This was real and going to happen. So that's brilliant. That's really nice to hear. So of course the operation date comes along. You make your next pilgrimage back to Parkside Hospital with your toothbrush and book and headphones ready. Tell me about the visit. Did you go the morning of the operation, travel, or did you travel the night before? What was the arrangement?
So I travelled during the day and was booked in the evening, and so you've got like the evening to settle down, and so you just sort of watch telly and have a bit of tea. The service is brilliant. And I couldn't fault it, really. I've been in hospital before, and it was very good. The care was great. The nursing staff were very friendly and supportive as well. Food was good as well. You had a menu. It was like being in a posh restaurant, and the room was very comfortable as well. So I was amazed at, I thought, blimey, this is like, being in Beverly Hills, It's good, yeah. So the actual operation itself was in the morning.
Yeah.
So in the morning, you have the pre-surgery things that you need to do to prepare yourself. You know, like for instance, you have a douche or an enema, so that's got to be done, and you speak to the anaesthetist, and yeah, so it's all very straightforward, really, as you would expect for any other operation.
Yeah, absolutely. It runs like clockwork, doesn't it? Then it's,
Yeah,
you know,
absolutely.
James comes in, anaesthetist comes in. Hello, good morning. Are you ready? All the consent process, check all the checks and checking who you are, making it sort of, you know, matching everything up, and then porter turns up, and before you know it, you're on your way to theatre. So yes, it's
Yeah, it's very efficient, and it's surprising how quickly, because you're so used to things stopping and having delays and having issues and all the rest of it. It just runs through like clockwork. Yeah, so you don't have time to worry about anything because it just runs through, you know.
Yeah. You're like a little parcel being kind of taken care of, and you can relax, and you know that people, you know, people will do what needs to happen for you, which is
Absolutely. Yeah.
makes a change, doesn't it? Okay, so obviously you're not going to remember much after the milky stuff goes into the back of your hand in the anaesthetic room. I think probably the next thing you'll remember, I hope, is that you're coming round in recovery.
Yeah.
And James talked about the fact that they put a little numbing injection into the back as well to help with the pain afterwards. So you'll remember probably coming round and recuperated. And obviously you'll have your checks in the recovery area before they take you back to the ward. And James talked about the bandaging being quite tight. So
Yes.
you've got a pack in the vagina itself that open.
Yeah.
And then you've got this really sort of tight, I think James described it sort of a nappy-like bandage that really is quite tight up between your legs there to hold everything in place. Tell me about that, because I'm sure that's what you experienced. So tell me a bit more about those first hours of coming round.
So the process of being anaesthetized was fine. You know, you have a little chat with the anaesthetist. He asks you like a few questions, and then suddenly you're asleep, you know, because he's, you know, doing stuff whilst you're answering the questions, you know, so you're not focused on all the needles going inside you, which is quite a good tactic. And then, yeah, obviously you're completely asleep during the operation itself. And so recovery, I remember just sort of trying to wake up, you know, hearing people sort of, is she awake yet? Is she awake? And I'm like, yeah, I am aware. And then going back to sleep. So it's a bit strange. And then when your corpus mentis, you're, you know, alert, and you're still very drowsy, and you're feeling quite high because you're on all the you know, anesthetic and everything. You're pushed through back into your room, and then you're hooked up to the morphine drip. And yeah, and you know, within like an hour, I was like, you know, thinking, oh, this is okay. I'm not in pain. I'm all, you know, my arms and legs are in the right place. Everything feels all right, you know. So, and yeah, I could tell that there's all this packaging there, but I knew that that was going to be there. And so, yeah, you're checked up on regularly by the nursing staff. And I had like a minor issue with some bleeding in about the next day and the day after. So I had to be rebandaged, and I had to have an injection to stop the bleeding that was administered by Mr. Bellringer. So that is the only kind of like issue that I had, really, which was pretty minor, really. I didn't have any significant blood loss or anything like that, and it's all very carefully monitored and everything. You know, they check up on you regularly and gradually wean you off the morphine, and so that you're you know, only on paracetamol and ibuprofen. So that's all very carefully managed and regulated, so you don't need to think about it yourself. And yeah, you just you know, wait it out, you know, sort of watch a bit of TV, do a bit of reading or whatever. And then you come to a point a few days later when the pack's removed. And so that's like quite a straightforward procedure, and you're rebandaged up again. And you're hooked up to a catheter as well, which is a bit odd. I'd never had a catheter before, and you're wondering, you know, I might need to go to the loo, but you don't need to because it's been siphoned off all the time, so you don't actually get the feeling like you do want to go to the loo. But obviously you get massively constipated, and you like spend like 3 or 4 days without, you know, doing a number two, and so you feel quite bloated, and you know, felt like I had a lot of wind as well, so that felt quite uncomfortable until the pack came off. And then when the pack came off and they removed the catheter, then that's quite difficult, actually. That's probably the hardest part of the whole thing, really, because you're starting to pee again through your new you know, equipment, and it's quite painful to begin with and uncomfortable, and you're sort of worried about things breaking and all the rest of it, but it's actually fine. It's very nice to, you know, have your first shower afterwards, you know, and there's blood everywhere, but, you know, I didn't mind that so much. Yeah, so it's all fine and straightforward, really. Those are the main things I remember, really. Yeah. You do have like a couple of days after the pack's out to, you know, to build up to your return journey, because you are still very weak, really, you know, so like getting across the room is like a struggle, you know. And you are in pain because, you know, once the morphine's off, then you've just got the paracetamol and ibuprofen, and if you're like moving around, it's quite painful. And I remember the waiting in reception for the taxi, and the taxi ride all the way home. It was very difficult, you know, because you're bumping about and you're in this terrible pain, you know, and it's quite a long journey, for 4 odd hours.
It is that
so make sure you've got a blanket and a cushion,
right.
so you can like sort of make things as comfortable as possible in the back seat of the car.
Right. Yeah.
Try and keep yourself, you know, as flat as possible.
Okay. And James mentioned when we were discussing it earlier about dilation, obviously because you had vaginoplasty, the need to kind of clean and dilate the vagina itself, and that was something that James said they teach you that just on those final days before you leave hospital.
That's right.
Do you remember that learning process, and how's it been? Because you're you know, almost 2 years out now from surgery. So how's that been?
Yeah. So on the day you start dilating, and the nurse came in with another nurse with the dilators, and you know, basically guide you on how to do it, and then they're there to watch you do it for the first time to see if you've got any issues, or if you've got any questions, or if you make sure you're doing it right, you know, and you're comfortable doing it by yourself. So and it's quite good that you've got like 3 days where you can do it whilst you're still in hospital. So if you've got like problems with doing it, then you can get help from the nurse. So that was good, yeah. And you're going to get like a lot of discharge while you do it. So yeah, you've got to make sure that you've got plenty of those squares to have at home before you go for the surgery, so you can, uh, be fine with all the blood and discharge and everything.
So plenty
And
of pads, a supply of pads and things like that.
yeah, that's right. Yeah, pads and things like that. And you've got to do it 3 times a day for 20 minutes, and that's a bit of a commitment, especially in the first 3 months when it's all new to you. You're struggling with the pain, and and it looks really bad because it's all swollen and blood everywhere. You're thinking, well, I shouldn't really be interfering with it. Why am I doing this? But you still have to absolutely do it. And it's quite critical in those first 3 months to keep with the regime and to, do exactly what the nurse advises.
Absolutely. And then you would have had a trip back then. There was a planned trip for you to go back to see Mr. Bellringer sometime later.
Yeah.
Were there any problems other than the fact that you were having a lot of blood and discharge, which obviously you were reassured what was normal?
Yeah.
Between your going home the first time, did you have any problems in the run up to your review, or did you make it as far as your review?
Yeah, I did actually have complications. So, and this is like a common complication,
Okay.
although you're obviously not guaranteed to get it. And that is when there's like a rupture in the suture line. So the suture line came apart within a week of being at home.
Right.
And I was very concerned about this.
Mm-hmm.
So I phoned up and they said, send photographs. And so, yeah, I took photographs with my device and emailed them.
Right.
And the nurse sort of looked at them with Mr. Bellringer, and they said, you don't need to come in for, a further op, which was a relief.
Mm-hmm.
And, it'll heal by itself, but it will take longer, and it's going to be obviously some pain. And it was infected as well, because of the size of the wound. And I found it quite challenging because I lived alone, although I did have, friends who could sort of call in and see me, from time to time, which was good. So I needed to get a prescription for antibiotics. So I remember, sort of going out to the doctors to get this prescription, and it being one of the hardest things I've ever done, because I had to get a taxi and go and get the cash out from the cash till to pay for the taxi, and then go to the surgery, wait and see that, and explain to the GP what I'd just done, and because it was a locum and didn't know anything
Right.
about the history,
So you're hobbling about, sort of.
Yeah, so that's the hardest thing really, was just getting around.
Yeah.
But if you don't have that, and you've got someone to help you around, then you'll be all right. So I was on these antibiotics for about 3 weeks.
Right.
Which is quite a long time, and both Miss Rashid and Mr. Bellringer said, yeah, you need to keep on these because it's taking a while, and there's a lot of discharge and everything. It's quite a challenging time with a lot of pain because there's a lot of swelling, but got through it, and then it did heal up. Yeah, it just takes time. It took more time. And thing is that you read that within 3 months you can be hello, and having sex with people and all the rest of it and live normally. Don't believe it. It takes longer to recover, to be honest, even if you don't have complications. And give yourself time, keep dilating. You've got to keep dilating,
Yeah.
And also because of the scarring, and that was particularly the case with me because of the rupture. I had a lot of scarring that seemed to take forever to get sorted, and was also causing um, an issue with the opening of the vagina, so I had to go back to have a perineum. What do you call it when you have the little snip at the
Right.
perineum?
Just to widen it up.
Episiotomy, was
Right.
it?
Episiotomy. Yes.
Episiotomy, is
Yes.
it?
Episiotomy.
Yeah, a
Yeah.
pediotomy. There we go. I had one of those.
Yeah.
And, so it actually took probably more than a year, probably almost 12, 14 months until it was starting to be right.
Because I think people have this idea. Of course, the best case scenario is that everything goes fine. You go home, you return, everything's fine. There's a nice, check. All your checks are fine, and within 6 weeks there's scar tissue, and then within 12 to 14 weeks everything's healed up and ready to go. But of course, that's the best case scenario, isn't it? And
Absolutely, that's the best case
about
scenario.
managing those expectations that actually.
Yeah.
You might be quite uncomfortable for a little while longer than that,
Yeah,
particularly to be able to enjoy sex.
absolutely. Yeah, and I was terrified because I had such bad scarring, and it looked, absolutely dreadful. I thought, I'm never going to be able to have a normal life, and will I even be able to have an orgasm? All of these worries crept in my head. But no, I do have really good orgasms, and and it's all fine now. You just need to be kind to yourself and give yourself time.
Be patient.
Yeah, exactly. Yeah, be patient. Yeah.
Great. So we've got to around a sort of, we've gone through those first 6 months. It sounds like it was all very difficult, and you had to be very patient with yourself and allow time for things to settle, and trust, I suppose, as well, trust that the surgeons were, the advice that you were getting was right. I think
Yeah.
a lot of people, if you see a lot of discharge, think, oh God, what's going on here?
Yeah.
And
That's
just
right.
get
You
through
can
that
panic.
slowly. Tell me about now. You said it's great now. Have you got a good cosmetic result? Have you got a good functional result? How are you feeling?
Yeah, I mean, I thought for a long time that I would have to have follow-up cosmetic work because of the scarring, and also the labia seemed to be too big, unnaturally so. But over time, it just improved, and so it looks normal now. So they say that after 9 months, see how it looks, and then decide if you want to have a cosmetic follow-up. It actually took more like 14 months until I was satisfied that I wouldn't need one. And I'm glad I didn't push for a cosmetic follow-up, because I probably would have caused more problems. And everything's fine now anyway, and functionally it's all fine as well. I've got about 5.5 inches of depth, although I don't have a sexual partner at the moment. I use, sex toys, so I'm comfortable with the idea of having sex,
Right.
And so yeah, everything functions fine. Yeah.
A lot of people talk about having fun with dilation. Once it's no longer painful, sort of swapping out your dilator for a vibrator and making it actually pleasurable and fun, rather than this thing that you've got to sort of go and do. You can turn it around and actually really embrace that and enjoy it once.
Yeah, that's right. Absolutely. Yeah. As soon as it stopped being like a chore, like, oh, I got to do this dilation again, and I've got this sort of issue that I'm waiting to have resolved, then I think it's when I was down to about twice a week. Then I went up to 3 times a week, so I realized that it was playtime, and it's nice,
Yeah.
and some weeks I do it more because I just felt like it, because it's, because you're masturbating, really, aren't you?
Exactly.
And then it's pleasurable, sexual health, it turns into sexual health as opposed to maintenance. And I probably do it, when I'm very busy, like have been recently with deadlines, with work and everything like that, and care responsibilities of the weekend. You can only do it like once a week, but that's the bare minimum. I try and still do it make time for myself.
Yourself, yeah, exactly.
Yeah, and that's really important to build self-care into your life, you know, to have that kind of like almost like a ritual where you're kind of like um, cutting out the pressures and strains of the outside world and having that you know, time when you you can, you know, invest in your own pleasure and,
Yeah,
you know,
absolutely.
cherish yourself and not just other people, you know, and that's good to do generally anyway, isn't it, you know?
Yeah, absolutely. And like you said, it's about moving from a very medicalized experience and, you know, to having a sort of this idea of a surgical body to your body, and that healing process and that ownership back, taking that back and it being part of
Yes,
you again, because it's
that's right.
a lot
Yeah.
of, there's a lot of medicalization in this, of course, and it's nice to have to be back to you now, and what you're, you know, what you enjoy, and put you first. So no, it's brilliant. I mean, you've shared so much. You've been so generous with your time and also your explanation and your own personal journey. I just wondered, before we finish, was whether there was anything else that you wanted to say to your viewers. Obviously, this isn't, you know, this isn't a conversation just between you and myself. This is to help guide people who are yet to have surgery, who might be thinking about it. So, did you have any final messages that you wanted to send out there?
Yeah, I mean, if I was having a conversation with myself, if I went back in time and I saw myself off the bus on the way towards my first appointment, I would probably tell myself this. Um, yeah, I would say, you know, don't panic when things look like they're all falling apart and going wrong, and you're physically falling apart. And there are moments when, you know, um, you're very ill and you struggle to get from one end of the room to the next, and you're in terrible pain, and you know you feel, you know, lonely, or you know you feel that things are going wrong and you don't know how they're going to get fixed.
Mm,
They do get fixed, but it takes time and patience, and you know, um, just rest. You know, you've got 10 weeks signed off work, and use that time. And even if you are working remotely, because a lot of people are working remotely, and I had, you know, the pressure being a self-employed programmer to sort of, oh, can you just do this, Jen? You know, um, be very strict, and you know, don't do more than a couple of hours a day whilst you're recovering, because your recovery will take longer if you're, you know, putting pressures on yourself and overdoing it, you know.
great.
So give yourself the time, be patient, and have plenty of rest.
Mm, great, thank you. Plan for the worst and hope for the best, as they say. So
Absolutely.
get your
Yeah.
friends involved, get, you know, make demands. Good for you. Thank you so much. This has been absolutely insightful for me as well. So it's been a pleasure to talk to you, Jenny. Thank you so much. Enjoy the
Thank you.
rest of your day,
And
uh,
you too.
and hopefully we'll catch up soon. Take care. Thank you.
Take care.